Hello my dear friends, I'm Dr. Vaishali Bharambe, Professor Anatomy. Let's talk about lymphatic drainage of lungs today. Lymphatic drainage of lungs takes place by two lymphatic plexuses, superficial and deep. There is one superficial plexus that drains the lung tissue, the pleura, and runs towards the hilum. See. There is a deep plexus which drains bronchi, blood vessels and connective tissue and also runs towards the hilum. Okay? Right. Now this all drains into the first set of lymph nodes, the bronchopulmonary or hilar lymph nodes here. From here, lymph begins to travel upwards through tracheobronchial lymph nodes, superior and inferior. Inferior are also called carinal lymph nodes. From here, lymph drains further upwards along paratracheal and finally they drain into the thoracic duct on the left and right lymphatic duct on the right. Through these, lymph drains into the venous system. Right? Now, applied anatomy, which is why we study all this, because it's got applied importance to it. For that, let's quickly touch on the trachea. Trachea dividing into two principal bronchi at an angle called the carina, which is about 70 degrees. Okay? Just below it, I just showed you the inferior tracheobronchial lymph nodes. Now, suppose these lymph nodes are enlarged for some reason, maybe cancer, maybe there's a tumor there. Okay? This carinal angle, which was 70 degrees, will be obviously widened out, right? So, increase of the angle of carina indicates possibility of thickened lymph nodes, possibility of a tumor. Let's carry this further. The point where the middle lobe on the right takes origin, okay, this point is surrounded by a number of lymph nodes. These are again the hilar lymph nodes. Okay, suppose the lymph nodes are enlarged, they slowly block off the entry of the middle lobe. Now what happens? The middle lobe collapses. This is called as the Middle Lobe Syndrome. This is a case of Bronchogenic Carcinoma, one of the most common cancers seen in female, accounting for nearly 30% of the malignancies. Common cause nicotine. Also today even the air we breathe is carcinogenic. So the cancer cells develop in the lung. The tumor cells show lymphatic as well as hematogenous spread. How do they spread? Now we have a good knowledge of lymphatics, right? So let's see how they spread. First they go to bronchopulmonary lymph nodes, tracheobronchial lymph nodes, paratracheal lymph nodes, right and left bronchomediastinal lymph trunks to thoracic duct and right lymphatic duct. Remember, there is also a certain amount of lymphatic crossover. So, cells can spread to the contralateral lymph nodes as well. Cancer cells finally enter the venous circulation. What will you do? You will take a lymph node biopsy. The pattern and extent of lymph node involvement is crucial in deciding the staging, the prognosis and the treatment for this patient. If you would like this lecture, do please like, share and subscribe to my channel and hit that bell icon. Do visit my website for more videos, surgical anatomy videos, MCQs, histology diagram videos. Link is in the description section. I hope you enjoyed this short, sweet lecture. I'll see you in my next video. Thank you. Bye.